specialize in esophageal diseases and gastric diseases like GERD and paraesophageal hernias. But more importantly, I would say, is I'm an early adopter of robotic surgery. So I adopted that early in my career, and it led to my interest in how technology is reshaping how we think about delivering care to our patients in and outside of the operating room. And I'm really excited to share some of those technologies with you that are really revolutionizing medical care at Keck. What's so amazing about this is that this technology is changing the way we think, the way that we're operating. It challenges us to provide better patient care and train better surgeons for the future. And what's great about it is that I'm going to show this video in a second. But we are putting a computer between the patient and the surgeon. And what that does is that it allows us to not only understand what is being done, but how it's being done. We've never had that before. And to have that data of how the surgery is being done leads to insights that are actionable, that can increase quality, and can help us train the next generation of surgeons to look like the experts quicker than how we've been able to do it before. This video is from the leaders in robotic surgery, Intuitive, explaining a little bit about how putting that computer between the surgeon and the patient is going to revolutionize the way that we do medicine. Hopefully it'll play. I didn't test it, but...
In the U.S., approximately 48 million surgeries occur each year, and about 2% of those will have some sort of unintended complication. That's almost 1 million patients who are affected.
There are multiple examples of how more efficient surgeons lead to better outcomes. How do we go from a complete novice surgeon to one who is a master? For the last decade, we've really tried to understand, quantify surgeon performance. Robotic surgery, it's digital. Suddenly, we have the ability to not only collect the data, but also to analyze the data.
And by being able to capture exactly what happens during an operation, that will give us the opportunity to understand what makes a good surgery, what makes a safe surgery.
Right now, what we're seeing is just the tip of the iceberg. The potential for this is endless.
If we decode surgery, surgical data science will transform robotic surgery.
So during that video, they show a diagram of this type of picture, which is the way an expert surgeon moves their hands while performing the procedure versus a novice. And I often think of watching a performance. So if you watch a dance group performing, they're technically all doing the same moves, but yet sometimes there's that one dancer that is moving with ease and grace, and you just are drawn to that particular performer. And there's surgeons like that too. And if it's been hard to quantify though, what is that it factor that makes them so different? Well, now we've got a way of quantifying it, and we can capture it and then teach it, which is amazing. I think this technology is really going to change how we improve our surgical skills for us and the trainees. One of the challenges that Dean Metzler also touched on is how do we adopt these new technologies so that they're safe? Because we want to make sure, as we're doing these, adopting new technology, that the users are going to know how to use that platform, use robotic surgery, whether it's robotics or endoscopic tools, before they go and use it on a patient, and that they can use it safely. So a lot of times this is kind of where the surgeon sits to do robotic surgery. I realized I didn't put a whole picture of the robot. You can look it up, Intuitive Da Vinci. It's crucial that we learn how to do the fundamentals of surgery using this platform before we get to the operating room, so we rely on simulation a lot. And these are some of the drills that you'll see are the surgeons. Any surgeon at any level who's going to start with the new technology has to start with simulation. The challenges are sometimes, though, there's limited access to the simulator, it's off campus, it's not within the surgeon's workflow. So there are companies that are trying to solve that issue with virtual reality. So now we get a headset and some controllers, and we're able to do simulation in our office, on our breaks, at home, so we can practice using that technology in a safe environment before we get to the OR. Because the last thing we want is to surgeon or any user coming in thinking more about the technology that they're using than the procedure that they're performing. So we use simulation a lot for that, and if we can move it into the virtual reality space, then we are doing a lot better job and can utilize it more efficiently. This is great for the hospital staff as well. So often, we get this new equipment, this multi-million-dollar robot, and we have to use that equipment not only to train our staff, but also to provide patient care. And that extra wear and tear on that device is often can lead to breakages and just wearing it out a little quicker. So now we can do that in virtual reality, simulate draping, moving, instrument exchanges for the OR staff that we're expecting to assist us in the OR, and we can do this in virtual reality, so we have less kind of wear and tear on the devices itself. Lastly, I'm going to show you is AI is also penetrating the operations and organization of these systems. As we adopt new technology, there are limited access or resources. So how do we get the most out of these resources? And there's companies, I'm not going to play this video, but there's companies like Qventus, or I could play it, okay, we'll play it. We have time. Qventus, you might be able to hear it, but I can talk over it. That basically looks at the OR blocks and helps with the organization and operations of the systems. So if there's limited OR block and it's not being used, notifying the surgeons through AI and taking all the information and data from past usages to get the best surgeon to use that time with the technology that's available and not putting that pressure on the OR staff and schedulers when there's so many people to manage. So kind of letting AI do the operations for us. And I think we are partnering with Qventus in the near future. So what is AI in surgery? It's innovations that push the boundaries of surgery and medicine. It changes the way we think, and it challenges us to provide better patient care. And more importantly, it could not be more in line with our mission at Keck as we strive to be trusted leaders in quality healthcare that's personalized, compassionate, and innovative. Thank you.
Do we have questions for fabulous Dr. Caitlin? Yes, Kathy Shirley.